it's all muted and nothing's actually streaming, it's just that image.
Oh, sure. If you want me to like, you got it? Okay. It's all good. It's good. He was, yeah. Well, I should say. He's halfway through fifth grade. He's halfway through fifth grade. We met a million years ago. We can help you. Please share down the chain. Yes, sir. Not slower.
Good afternoon, everyone. We are here today to announce the first diagnosed case of COVID-19 in Washington County. The woman in her 50s is in good condition and is exhibiting mild symptoms and is isolating at home. The health department has begun investigating the case with the help of the Maryland Department of Health. Communicable disease nurses from the health department are in the process of identifying contacts and advising them of any necessary actions that they would need to take. The health department will also share information as it becomes available as soon as possible if there is any risk to the public identified. We are grateful that Washington County's first case of COVID-19 is experiencing mild illness. Based on what we have seen in the rest of the country and the rest of the state of Maryland, we have expected this. We have been planning, we have robust plans in place, and as we move forward, we will probably see testing increase, and we should expect more cases. I know that people across the country, across the county, may be feeling as though they need to panic, but again, this is no time to panic. This is time to continue planning and continuing to prepare yourself and your family and loved ones. I also know that people across the country and people across our county have been asked to adhere to very rigorous restrictions in their activity. I appreciate everyone's cooperation as I strongly believe that social distancing is critical, and I'll repeat, critical to saving lives in our community and reducing the spread of this virus. It's important for all county residents, and I stress all county residents, not just the young, not just the old, all county residents, to be vigilant and to do everything in their power to prevent the virus from spreading. Meredith Medical Center has activated several COVID-19 testing locations, and they also provide a care line for individuals to call in. We will hear about that momentarily. While considerable awareness has been communicated regarding the risk of older adults over 60, this case shows that younger people must also take precautions. Younger populations who are healthy are not immune. And I repeat, younger people who are healthy are not immune from this. Everyone, do your part to prevent the spread of the disease. Always cover your coughs and sneezes with a tissue or your sleeve. Stay at home if you're sick. You should be staying home anyway. but avoid close contact with people who are sick. Avoid touching your eyes, touching your mouth, touching your nose with unwashed hands. Wash your hands often with soap, and you do the birthday song twice while you're doing it for at least 20 seconds. And or use alcohol-based hand sanitizer with at least 60% alcohol if soap and water is not available. Clean and disinfect frequently used items, including your phones. I think a lot of people are overlooking that. Keyboards, phones, all those good things. And again, one of the most critical, probably second to washing your hands, is social distance. The governor and the federal government have put these restrictions in place for a reason, and we all must adhere to this. Lastly, accurate information regarding this virus is critical for our community. There's a lot of information out there on social media, news sites, and the like, but make sure you're getting accurate information. Washington County Health Department at washco.org. Washington County Government has a website at washco/maryland.net coronavirus/info. Maryland Department of Health at coronavirus.maryland.gov, and of course, Centers for Disease Control at cdc.gov. Again, we are here today to announce what we had expected, that we have the first case of COVID-19 in Washington County. To reiterate, it is not a time to panic. It is a time to continue to plan. It's a time to continue to prepare. With that, I will turn it over to Dr. Malik Joshi from Meredith Medical Center.
Good afternoon, and thank you, Earl, for your leadership, and to the Department of Health for what you're doing, and to the county for the incredible coordination efforts. I'm very proud, and as an organization, we are grateful to have such wonderful partners in addressing this community-wide issue. I'm Malik Joshi, President and Chief Executive Officer of Meredith Health and the Meredith Medical Center, and I'm privileged to work with an incredible group of doctors, nurses, therapists, and all clinicians working hard to take care of this community. As Earl said so well, this is not a time to panic. We want to reassure the community that we have been working on this for 2 months, and we continue to work on this together as a county in a coordinated effort every day. Planning before this is important, but planning during is even more important. That's what we do together. To support all of our efforts, you know that providing access to all our residents is critical. So as we've talked about, we do have a drive-through testing COVID-19 center at our Creighton Boulevard site. That has been in place for the past week, and just in the last few days, we have swabbed over 660 individuals for COVID-19, 660. We expect that to grow. We see 200 people a day at that site, and next week we are opening up 2 more drive-through sites to provide more access to people who may have questions about COVID-19. I would encourage you to go to the website, both Meredith Health and of course the county, to look at the criteria for COVID-19 testing. Today, we are swabbing for both flu and COVID-19, and you know the symptoms for COVID-19: fever, coughing, difficulty breathing. But we really encourage you to use our telephone line or speak to your physician so that it may be appropriate for you to go through this screening. And again, anyone who has had within 14 days of symptoms with a confirmed COVID-19 patient should contact their physician. Again, I would encourage you to contact your physician by video or by telephone. Meredith Health has available on the website free telehealth availability to talk to a provider about any issues you have. So again, access through the drive-through, through our email, through our telephone line, and free telehealth. We want to provide our assurance and as much as we can to all our residents. If you have anyone who is mildly ill, and I think Earl said it so well, please stay at home. Social distancing and self-quarantine and washing your hands is critical. And of course, get in touch with your doctor. If you do not, again, have a primary care physician, don't hesitate to go on to meritushealth.com and get a telehealth visit for free. And of course, if your symptoms are more severe, please call 911 as appropriate, and again, reach out to your doctor. Flu is still present and continues in our community, so we are continuing all efforts around that. Again, thank you to Earl for emphasizing social distancing, so again, we can address that as well. I hope the community feels completely assured and trusted in the wonderful partnership and coordinated effort we have as Washington County. Please continue the most important things. Wash your hands, social distance, take care of yourself, take care of your loved ones at the appropriate distance, and by doing that, we'll be taking care of our community. Thank you.
Good afternoon. I'm David Hayes, Director of Emergency Services here in Washington County, and obviously am part of the Emergency Operations Center team that's the lead coordinating agency under the Health Department who serves and maintains the lead status as we move through this epidemic or pandemic. I also serve on the county's Continuity of Operations leadership team that is helping guide the county administrator and county commissioners through activities and modifications in county government in an effort to try to make sure that government services remain available at the appropriate levels to all citizens and businesses of Washington County. Relative to the Emergency Operations Center, it remains at full activation, and through that, our original plan was to work Monday through Friday in a reporting format and Saturday and Sundays through a virtual environment. Obviously today, that has brought our team back into a reporting environment, and it is likely that we'll stay in a reporting environment tomorrow and all of next week, and then we'll evaluate from that point forward. The Emergency Operations Center continues to work on med-surg plans. That's in partnership with Meritus Medical Center, the Health Department, and other local county and city entities to ensure that the public safety sector is prepared to answer the call as this epidemic moves into our area and continues to become more of a strain on everyday resources. Our local law enforcement agencies, both county and city, are working hard and are partners in each of these efforts and are included in the communications and planning efforts within the EOC itself. We have recently activated what is called Emergency Support Function 18. That is business and industry in an effort to make sure that messaging and coordination is consistent amongst all groups and to try and provide the power of the EOC and a coordination function to groups like the Chamber, Greater Hagerstown, our nonprofit business groups, churches, and things like that. So we're trying to look at this as a community-wide approach, and our intention is to not be exclusive of any one component of that. As you've heard before, we expected this day would come. Today really doesn't change much for us other than we want to make sure that we are in a position to reassure the community that all levels of government, both county and city, and all layers and components of the local communities are fully engaged to make sure that we are in a positive position as this epidemic continues to move through our area. I want to reiterate, continue to wash your hands, be aware of your activities at all times. That is your social distancing and where your hands are at any given times. It's inherent for us to move our hands about throughout the day, to include putting things in our mouth like pens, touching our eyes, our face. Those simple procedures will help us control this virus. I want to thank everybody for taking time to attend this press briefing today at a last minute. And most importantly, I want to thank all of our partner agencies for the extreme collaboration and cooperation that brings us to a point today that we feel comfortable we can stand before you and assure you that we are in the best position we can be relative to the information that's known and the status of this virus in our community. And with that, I'll open it up to any questions, and I'll redirect if it's not something I can specifically answer.
is kind of based on our hospitals being prepared to handle the amount of patients. What can you say about Emeritus's preparation?
So I can certainly turn that over to the doctor here, but I'll answer that at least from the emergency services world and the emergency operations. Emeritus Medical Center has had all levels of staff engaged in the emergency operations center and working through the preparedness for these activities. But the one thing I did want to speak to that, and then I'm going to turn over to the doctor to specifically answer, is the social distancing, the types of shutdowns that you're seeing that are unprecedented, not only in our county, but in our state, but in our nation, are necessary to go back to that term that you hear commonly, flatten the curve. We're trying to slow this virus spread down so that the number of sick and ill, which is only historically now 20% of the population, but 20% of the population, if that 20% is greater than medical's capacity, then we still lose the battle. So our efforts are to slow this thing down. We know people are going to come to the hospital, but we need them to come in numbers that are manageable. Even with surge capacity, there is going to be a limit with that. So again, it comes back to what you've heard the two speakers before me. Please, please, please listen to your leadership's guidance on stay home, wash your hands, social distancing, be aware, you'll be okay. And you'll help us make sure that the vulnerable population will also be okay. But I'm going to turn it over to the doctor to try to better answer that question.
I actually think you said it very well. Unfortunately, there are some inconveniences if you're a visitor or others who want to see your loved ones, but we are absolutely focused on flattening the curve, that was just said, and that will get us better in the long run. So I ask the residents of our county to just please be tolerant as we work on this. Obviously, if there's any need to see a loved one that's appropriate, we will do that, but we want to provide that distance so we stop any spread.
Can you tell us about the patient? Where is she from? What is her background? Where is she housed right now? Can you give us as much information with regards to the patient that you've referenced, a 50-year-old woman?
Yeah, at this point, the information that I provided earlier is all that we can disclose due to privacy concerns.
Was she traveling at all? Do we know if she's traveled in and out of this area?
No, it was not travel associated.
And where is she? Is she at Meritus right now?
She is isolating in a home.
Hi, with the 660 tests that were run through Meritus, was that just at the drive-through facilities or was that overall at Meritus, like in total?
The 660 were from the drive-through one center over the last week. We've done a handful of tests just in the hospital, but all COVID testing is happening at the drive-through.
Okay, before we close out, one last time, any other questions that we can try to answer for you today? If not, we'll be in touch if there are any further developments as we move forward. Yes, ma'am.
I was wondering if you have any guidance from the state, whether there's going to be any further closures, that sort of thing.
At this time, to my knowledge, and I think I can speak on behalf of county government here, we have no knowledge that there are additional closures or restrictions coming forward.
Thank you.
Anything else? Okay, thank you for coming. We appreciate you taking your time.